Okay, so welcome to everyone to this lecture or this talk about glutathione and the role of glutathione and oxidative stress in the veterinary health. So the plan for this next hour is to share with you a little bit about this molecule, about this glutathione, which is the homeostasis and how it works, but also the relation with the pathologies. How can we relate the oxidative stress, chronic pathologies into the veterinary medicine in the animals? So I will focus on cats, dogs, and horses. And also, finally, we will try to make a presentation about the veterinary health project. Yeah, how can we also benefit ourselves from these glutathione precursors? So, for some of you who don't know me, I would like to make a little short presentation. My name is Lorena. I'm Dr. Lorena LLoret, and I become licensed veterinarian in 2002 in the Murcia University. You can guess by my accent that I'm from Spain. So yeah, apologize for maybe any word that you know my accent maybe don't understand. But okay, anyway, I become veterinarian in 2002, and then very soon I become interested into the veterinary acupuncture, Chinese medicine, tuna diet, all the disciplines that actually belong to the TCVM, which is traditional Chinese veterinary medicine. I start my journey on TCVM in 2003, so not bad. And since then I've been studying and working, and I become PhD. Many other present that came. So I devoted my life really to TCBM and also to the expansion of this medicine. Not only TCBM, but also integrative veterinary medicine. So the goal with the TCBM, for those of you who don't know, is more like seeing the animal as a whole, as a holistic, right? So my goal also has been expanding through Europe and other countries around the world, expanding the vision of TCBM and expanding of the integrative health, so every animal can be seen as a whole system, not only as a disease. For that, I've been very lucky because I've been able to do presentations, and I'm professor at the two universities, so I teach veterinaries around the world. So all of this just to understand better about the animals, about the aging, about how can we provide the best quality of life for them. So since 4 years ago, me and my family, or my family and me, we moved to Ireland, and now I live in Ireland, and I run an independent small animal and equine clinical service. I give different clinical settings, clinical service, both for horses, but also for small animals. So saying this, my interest about glutathione starts about 6 months ago, 7 months ago, from a personal history that I will tell you later. And then my good friend Marta, which is actually today here with us, she introduced me to the glutathione precursors. And I was like, what is this? And then I made a research and I started to learn more about glutathione, because the more I learn, the more I want to know. So this bring me, okay, I love energy, of course, energy work, but I'm also scientific. So my science part want me to know more about what is about this, what is glutathione. So then I remember from the university, glutathione is that peptide. It's a molecule that is participation in cellular homeostasis. And the central role is antioxidant, right? It's a defense against oxidative stress or oxidative damage, which is aging and other death, death cells, we can say. So glutathione it's made of three peptides, right? One is glutamate or acidoglutamic, cysteine, and glycine. So why is so important? Because it is the main antioxidant for every single cell in our body, not only for humans, also for animals. Is helping protecting from any reactive oxygen rows. We will see them later. So it will protect the release of free radicals. So glutathione, which is such an important, is the most abundant molecule after water in the body, with such an important role. We need to go further. Right? Then I went to PubMed. Everybody knows PubMed, right? Like a professional and medical research. So I went to PubMed and say, okay, what is about glutathione? How many studies can we find about glutathione, for example, on horses? And then I find 500 studies, not too many. I mean, not bad. It depends on how we see it, right? Because if you go to only glutathione, you will go over 200,000 studies, which that's a lot, more than vitamin C and vitamin E together. However, in relation to horses, still a lot of work to do. What about dogs? Okay, a little bit more, 1,386, over 1,000, so like 1,400 should be by now. So that gives me more interest and say, okay, so how can I understand? One of the things that I found that, okay, there is some lack of knowledge in us veterinarians or therapeutes or those of us we love animals and we work with the animals and we want their life to get it better. So I want to understand better and I want to explain better. So I found this clinical trial, which I found, okay, only for this one, we should try glutathione, okay? Because actually, what it is, an expression of different glutathione and glutathione enzymes in canine mammary tumors. It's one of the most popular or, abundant tumors in our dogs. So they made this study with 30 different animals, yeah, with canine mammary tumors. And they relate of different results. So let's see. They found that the expression of glutathione oxidase, redox, and glutathione different enzymes was compared, and the results show incredibly because the high expression of redox glutathione was correlated with absence of tumor ulcers. That's so important. And also, the dogs who has more glutathione in their cells, they have no metastasis. And this means statistically significant. So there was a significant correlation of survival with the increase of glutathione. So the high expression of this glutathione played an important role in this clinical outcome of patients with mammary tumors. What it suggests that glutathione can be a prognostic marker. So animals who has a high glutathione, then they will have less metastasis, longer survival times, and absence of tumor ulceration. So only for this, I want to know more about this glutathione. I want to know how to rise glutathione in the cells of the animals, especially on the chronic patients, especially also cancer patients. And then therefore, that's why I create this talk or this presentation, because I made research on PubMed, Google Scholar, and then I say, okay, let's see what's going on with this glutathione. How can we increase the glutathione in the cells of our animals? So understanding glutathione is this molecule, we say, that is essential for cellular homeostasis in the whole body and plays this central role defending against oxidative stress. So the biosynthesis and bioregulation of glutathione we need to understand for this that glutathione is synthesized in the cytosols of the cell. So what do you mean cytosol? I mean intracellular, right? So this is going to be one of the key factors, because the GSH or glutathione synthesis are determined by two factors. Number one, the negative biofeedback of the GSH on the glutamate cysteine ligasa, but also which is the availability of the cysteine. Cysteine is going to be the more critical peptide to create glutathione. Why more critical? Because cysteine has some characteristics, it's thermolabile, and is easily destroyed, when we take it orally or we try to take glutathione internally. We will go over this later. So the genes are related to glutathione synthesis, are stimulated when the cell is under oxidative stress. For example, we know insulin stimulates the production of glutathione. Therefore, diabetic patients have a decrease in erythrocyte glutathione, making these cells more susceptible to the oxidative stress. And moreover, from 10 to 50% of the intracellular glutathione is found on the mitochondria. This is twice the concentration of the cytosol. That's because mitochondria doesn't have catalase. So mitochondria, for those of you who know or who don't know but you want to remember, then they are responsible for producing energy in the cell, right? ATP, which in turn will generate free radicals. And if these free radicals are not eliminated by the electron donor, by the glutathione, then the mitochondria will oxidize, and then the cell will be dead. So this is how any chronic disease generates, including oncological. There is a mitochondrial dysfunction because decrease and depletion of glutathione at the mitochondrial level, and that will lead to oxidative stress. So this is very, very important to understand. Also, in which organs we find the most, let's say, quantity of glutathione or synthesis, which are the more important. Okay, the liver and the kidney, they are the main organs involved in the synthesis, but also degradation of glutathione. So most of the glutathione redox is exported to the extracellular matrix, and the half-life is from 2 to 6 hours only. So here it comes, this is the picture of a cell, and here it comes, here we have the mitochondria, and we have the cellular impermeability of the GSA, of the glutathione. So the cell will prevent the direct passage of the glutathione through the membrane, like a barrier. Once it is exported from the interior of the cell to the matrix, it will not be easily re-entered, and is actually degraded into cysteine, acetylglutamic, and glycine. And this is central because we have no cellular transporters of glutathione into the cell. And that's why for so many years, it's been so difficult, and is still, very difficult to reach really a good levels of glutathione in the cells once the animal has deplete levels, or when we become older. Let's say we humans as an animal, right? We have no cellular transporters. So maybe some of you tell me, okay, Lorena, but I went to the health store and I see that there is glutathione liposomal or glutathione in tablets, or I went to a clinic and they put me glutathione intravenous. And I say, or even nasal, or sublingual. There are many ways in the market. Yes, they are, but no one of them is really effective. Why? Because there are no cellular transported into the cell. So actually, it's going to be absorbed like maybe 5%, of what you take. The glutathione injections IV, they are effective. Yes, they are. But the mean life that they have into the cell is about minutes. All of this I'm saying is in PubMed and is really studied. So it's been a real challenge for over 20 years to find a natural precursor of glutathione, right? So we have some facts. Fact number one, the cell and the glutathione, the internal glutathione synthesis. The glutathione must be produced inside the cell because it cannot easily enter from outside. It's going to be only like 5% entering. So you're going to waste your time, your money, and your effort and your energy. Same for the animals. Plus, it's a synthetic glutathione, right? The key is to create, to produce inside the cell, inside our bodies. So if we can give the food that the three peptides that we need to create our own glutathione. Number two, antioxidant, detoxifying. We need this. We need internal glutathione for the main functions that glutathione has, which is antioxidant, because it's the master antioxidant. So it's the one who donors electrons to help the other antioxidants, vitamin C, vitamin A, vitamin E, D, is the master antioxidant to help the others to work. So it needs to be created intracellularly, and then also efficient detoxification, right? To detox all the different metals, and yeah, we will see all the toxicity that we actually day to day get into our body, same than our animals. So the key functions, glutathione is involved into 1,500 functions, at least in the body, but we can resume in 4 key functions. Number one, antioxidant, right? I will say this, glutathione is the master antioxidant, protects the cells from the damage created by the free radicals and oxidative stress. It maintains cellular integrity. It maintains the cells alive. Number two, detoxification. It really participates in the detox, in the detoxification of the liver, helping to eliminate harmful substances and facilitating the cleaning of the body. Number three is an immune system booster, but also regulator. It can really regulate the glutathione release. Let's mute everyone. And glutathione strengthens and regulates the immune system, helping to fight infections and promoting overall health. Number four, energy. Energy to the cell is the most generous electron donor at the mitochondrial level. It prevents oxidation and prevents the cell death. So with all these four functions, we can easily think about the idea, right? How good idea is to prevent this, and how good idea is to raise glutathione in our cells, also in the cells of our animals. Okay, mind me, this is in Spanish, but it's easy Spanish, it's okay. So glutathione is involved into cellular division, into defensive system, into the protein synthesis, also in the sulfur metabolism, selenium, also antioxidant, detox, DNA repair. That's so good. Is involving also in the epigenetics together with the gene NFR2, and also is helping for the signal of the cells, right? So let's go a little bit one by one of this. Immunologically, we need a good level of glutathione necessary for the lymphocytes proliferation. We say at the beginning of the talk that glutathione is in every single cell or body, right? On human, animal, plants, in any alive being. So we need a good levels of glutathione for lymphocyte proliferation in the development of the immune response. When the macrophages, the CPAs, come into contact with the T cells, they will supply the cells with additional amounts of cysteine, and thereby they will rise the intracellular glutathione. Cysteine is going to be the key, right? Cysteine is one of them. You see, glutamic or glutamate and glycine, we can take it from the food. That's easier. However, cysteine even exists on the food. We know it's on the raw milk, it's on the raw eggs, it's on the raw fish or meat, is on the raw vegetables. But as soon as you cook it, you warm it, then it's thermolabile. It's going to be destroyed. No more cystine. Or even, okay, then you can think, okay, I'm going to eat the raw meat. Good. But the acid of the stomach is gonna destroy as well the cystine. So it's not easy to find cystine in the system. Then the function number 2, detox of xenobiotics. So they are biological toxins, but also their metabolites. They are conjugated with this, and they are excreted by the urine, by the feces. Number 3, maintenance of the intracellular redox balance. So what is the redox balance? It's about the ability of the body to balance the loss of electrons in molecules. We call GSH like the kindest antioxidant. It's always giving up electrons to balance every single molecule. So when the electron give up, it will exhaust the cystine and then will oxidize. So there is no antioxidant like vitamin C or E or selenium could be functional and reduce it without the presence of glutathione. So that's why so many times it's like, oh, I'm taking big quantities of vitamins, but still becoming sick from time to time, or still weak, or I don't feel really the energy or the power of these supplements. Why? Maybe because your glutathione is really low. So you really need to raise your glutathione levels. So glutathione GSH is going to be the major determinant for intracellular redox potential. It's going to intervene in enzymatic activity, cell transport, signal transduction, also expression of the genetic, as I say just one slide before. And number 4 is the master antioxidant. So, and I will repeat 100 times because it's so important to understand this, that no endogenous or exogenous antioxidant will function properly without glutathione. Under conditions of severe oxidative stress, the cell ability to reduce oxidizes glutathione to unoxidized glutathione, this is the one that we want, it will be impaired. So then the cell will not be able to reduce. So we need the cystine, we need the blocks, the building blocks of this glutathione. So what means free radicals? Which are the origin? Could be endogenous, could be exogenous. I'm talking about repetitive or reinfections. I'm talking about processed food. We feed our animals constantly with dead food, like processed food. I'm talking about contamination or smokes or radiation or different medications, drugs, stress. Do the animals have stress? Of course they have, like we do, yeah? They live in our households. So they actually are able to feel and to trap any of our stress. Also elderly, they live longer, and also different pharmacological. All of these will accumulate free radicals, will create oxidative stress with the toxins, and this, therefore, will lead to loss of glutathione. So then, if we lose glutathione, what's going to happen? It's going to have an cellular oxidative, and then disease, and likely, of course, the death. So how regulates glutathione the growth and the cell death? From the cell to enter DNA synthesis phase, during the cell, we need optimal levels to glutathione. So the decrease in glutathione will play a very important role in this onset of apoptosis, and the drastic decrease in glutathione at the mitochondrial level will lead to dysfunction and the cell death. So I think for now we have quite a good idea of how is the homeostasis of the glutathione. But maybe some of you veterinarians, my friends, that we are here today, you think it, but what is the clinical relevance of all this? What clinical relevance this has? It's going to be very important. The determination of this, the determination of the concentration of the glutathione in the blood could be used like an indicator of the status of the homeostasis and the risk of the disease of this animal. So the less glutathione, the more risk to oxidative stress and the more risk to chronic repetitive diseases. So saying this, here comes the second part of this talk, because I was thinking, okay, now we understand glutathione, we understand how important it is, we understand that it needs to be created intracellular. And now my next question that I did to myself, I was like, okay, so which are the pathologies related with oxidative stress? Because we know oxidative stress, the meaning is the same than low glutathione. So I want to know in which pathologies I could help if I am able to raise the glutathione levels in our animals. So this imbalance in between the production of reactive oxygen species, or ROS, we're going to call them ROS from now, and the body antioxidant defenses is involved in different pathologies that will affect, of course, dogs and cats, and the cellular damage is a key factor in the development of or progression of different systemic diseases, especially those that involve inflammation, chronic inflammation, which is one of the number ones, but also aging. So I made like a little summary for you of which are the more relevant in which, let's say, in which pathologies we can find studies that support and say that oxidative stress is the key factor, okay, for that. So number one, DCM or DMC, myxomatosis mitral valve disease and dilated cardiomyopathy, yeah? These conditions in the dogs, they show increased biomarkers of oxidative stress and reduced antioxidant. So this is important. So we could think that how this DMC is dilated cardiomyopathy is related to low glutathione. Same on the heart failure, right? Or tracheal collapse or brachycephalic obstructive airway syndromes, also COPD, right? Chronic respiratory conditions related to oxidative stress, hypoxia, and chronic inflammation of the airways. What about cancer? As well is another one, yeah? The connection between oxidative stress and cancer is very complex, but oxidative increased levels are associated with several canine cancers, and we can find studies in mammary gland tumors, like the one that I saw you in the very beginning of the talk, lymphoma, but also mast cell tumors. ROS will damage DNA. This will activate genes to promote tumor growth and contribute to cancer development and progression. The breast tumors could be benign or malignant, we know that, but they both are correlated with oxidative stress because there is an increase of the enzymatic activity of this superoxide mutasa and glutathione peroxidase. Also prostatic carcinoma, also canine lymphoma. There has been seen an increase in free radicals and a decrease in antioxidant capacity. Also, GI diseases, liver diseases. We say that the liver is the number one organ in which glutathione is created, but also oxidized. So IBD, right? Inflammatory bowel disease. Oxidative stress is a major factor. Liver disease, yeah, in the different levels, we can say, of liver, like chronic hepatitis or even hepatitis because copper or intoxication of the liver, right? Or even liver tumor. Also, parvovirus enteritis, yeah, is leading to oxidative stress. What about kidney disease, chronic kidney disease? The oxidative stress is contributing to the progression of CKD in dogs. Yeah, so mind that also there decrease with disease progression. Study shows that while oxidative stress is the highest in the early stage, it could be decreased in the later stages. Hematological disorders, anemias, right? But also ehrlichiosis, parasitosis, Ehrlichia canis, yeah? That they create a big oxidative stress, contributing to hematological abnormality, thrombocytopenia, any red blood disorder. Infectious disease, oxidative stress is related to, for example, leishmaniasis or babesia, right? Or Demodex or sarcoptic mange. As well, if we consider any chronic inflammatory disorder, dermatitis, osteoarthritis, arthritis, pyometra even could be on the beginning related with oxidative stress. But what about neurodegenerative disorders? The nervous system, high oxygen consumption, make it vulnerable to oxidative damage. So it's very important for cognitive dysfunction. And we know our dogs or cats, they live longer. How many dogs we have with cognitive dysfunction in the clinic? So many of them. No, there's nothing we can do. Or we can give even ginkgo biloba, other herbal. Yes, but we can also now have a tool to increase glutathione in the blood. Also, other neurological problems. Let's say even that the senile plaques with deposit of the amyloid protein has been detected in the brain of elderly dog, and this is similar to Alzheimer. And Alzheimer is directly related with oxidative stress and depletion of glutathione in the cells. You can, as I say, everything I'm saying is based on research. So you can easily go to PubMed and find Alzheimer and glutathione, and you will be amazing about this related. But also in ophthalmology, glaucoma, retinal ischemia, right, is related to oxidative stress, and also neurogenic dry eye. So this brings me to the first case, and it's my personal case. He's my dog, Harpo, that this May in 2025, I want to share with you. He had a trauma, injury, things happen, in the groomer, and then that created a ulcer. But okay, we were healing, we were treating the ulcer in conventional way, no problem. But then after the ulcer heal up, unfortunately, he developed, as you can see in this half of his face, right? This part, he developed neurogenic dry eye. So neurogenic dry eye, okay, mucus, dryness, an inability to create lacrima, right? To tear production. We start with regular medical treatment. Unfortunately, as I told you in the beginning, I do acupuncture, Chinese herbal medicine, yes, but my dog is not a very good fan of acupuncture. He was a model for so many years in my classes that now he's like, okay, I have enough. I don't want more needles. So he's not a dog that I can use needles around the eye, which will be also a good option for him. So I had no tools. The herbal medicine didn't work too well either without the acupuncture. So then, okay, I start with regular medical treatment with a very good colleague of us. And then, okay, she give me the diagnosis, and then we start with washes and hydration and the pilocarpine. However, pilocarpine, he was not responding, and also pilocarpine secondary issues, right? He will start to have a heart flutter, and he could have fainting. It never happened, but it could happen, especially in a long term. So I was not happy with that possible solution. And then as I say, my best friend Marta, she recommended me a product. She recommended me precursors of glutathione. And that's how I start becoming interested in this. And then I start to give him this product that I will tell you later. It's called Immunical. Immunical Platinum, Immunical Blue. Also topical eye washes with sterile saline and Immunical were given. And then I did different doses, you see, from the first week, and then the second week I decrease, then I start again. This is the dosage guideline. Yeah. So if you're interested to know more after this talk, I will be more than happy to help you. So the dose of this Immunical is a natural precursor of cysteine and the natural whey protein with cysteine. So it has no secondary issues, no problem. Sometimes in some dogs, it may happen a healing crisis, but as soon as we reduce the dosage, then nothing is happening, right? On his case, I start very, very strong, and then I have to reduce a little bit because he started to have loose stools, and then I went back to big dose. So what happened with him? Believe it or not, from the third week onwards, he started to generate tears. Me personally, I was impressed, but also couldn't believe it, because okay, this is supposed to don't be regenerate. Okay, the news that the from the Western medicine say like no, it's gonna be for life. So he started to create tears. 5 of the streamer test. 6 weeks, he did 10. So for those of you who doesn't know, this is about the testing about how much tear production, right? Anything from 15, it's going to be good for him. So from now he's in 18. So he's actually full heal, right? And he is still taking the immunocal, yes, but from maybe one sachet every 2 or 3 days. And he's still happy and perfect, as you can see in this picture. So he gave me the light to keep on going and researching more about this, and then I start to use it also in some of my patients. So, I want to talk now about feline. In which feline pathologies we can actually find a good use of precursors of this product, of precursors of glutathione. Cardiovascular disease, similar, right, to our dogs. Hypertrophic cardiomyopathy, for example, there is studies that they relate this with oxidative stress. Also diabetes. Also diabetes for dogs. We can use precursors of glutathione for diabetes. Also hyper or hypothyroidism. Oxidative stress is related. So levels of glutathione are low in this. And again, kidney disease. And again, this is important for cats, periodontal disease, right? We can use the precursors of glutathione for this inflammation of the periodontal disease. Also, an hemolytic anemia, right? It is unique properties that this feline hemoglobin make vulnerable to oxidation. So again, hemolytic anemia is related to lower glutathione in the blood. FIB infections or obesity with all what it creates, the oxidative stress and all the alteration in the hematological. GI disorders, sure, peritonitis, lipidosis. This is so important in the cats, as we know, right? And also pancreatitis, very, very common, right? Unfortunately, in the last years, pancreatitis, enteropathies, right? Why? Because the processed food, because all these lower glutathione levels. So I want to share with you this case. She's Minnie. She's my patient for acupuncture, as you can see here. She's wonderful. She's a saint, and she loves acupuncture. She's one of the best cats in the world. She was diagnosed with grade 3 breast carcinoma, and they did a partial mastectomy, like 2 years, over 2 years now. So since then, we treat with TTVM, acupuncture, herbal nutrition. So she was very stable for a year, and then we see a little lentil mass, recurring in the other mammary line. And then, she was good spirit, normal life. And she is 2 years later taking the herbal acupuncture and immunical. We start with immunical maybe she started right after Harpo. So that masses has not grown. It's actually, we consider they're actually more soft, more soft and less inflamed. They have stabilized, and she's still with excellent quality of life. But she is coming to acupuncture. So I strongly believe also this is very important to make attention, please, because acupuncture, Chinese herbal medicine, food, good food, all we do, this is antioxidative therapies. So when we incorporate glutathione precursors, we actually help the body to heal faster. We help the body to have this acupuncture more effective, even more effective. So it's a nutraceutical. This product, this glutathione precursors is a nutraceutical. So we can never have too much, let's say. So it's a nutrient with therapeutic activity, but it's important to don't leave the other antioxidant therapies that you are doing, with your animal. What about equine? I love horses. I'm sure many of you love horses too, because they are incredible. And I was wondering, what about oxidative stress? In which equine pathologies are linked to oxidative stress in horses. And I found a lot. I found respiratory, COPDs, neurodegenerative, also head shakers, myopathies, gastric ulcers, laminitis, so important, also reproductive issues. So let's see some of them. RAO, recurrent airway obstruction, very important. This is linked to oxidative stress. Also COPD or HIVs as well, asthma, chronic inflammation of the airways. We need to add to our techniques, to our therapies, we need to add precursors of glutathione. What about equine pneumonia? Oxidative stress is also investigated in this. Very important bacterial pneumonia for foals. Equine motor neuron disease, deficiency of vitamin E is also linked to oxidative stress or degenerative myeloencephalopathy, right? Neurological disease, spinal cord injury, any chronic inflammation, yeah? Tie-up, myopathy, very important in horses, related as well to oxidative stress, or Cushing disease, insulin resistance, obesity, right? This is very important, hyperinsulinemia, oxidative stress. More than that, very important, EGUS, equine gastric ulcer syndrome, it's been reported that is linked to oxidative stress and low glutathione levels. Laminitis, super important. Hoof health, right? Everything starts on the hoof. Tissue damage, again and again, especially chronic laminitis. We need to increase the glutathione levels on those horses. Also, stereotypia or behavior problems, right? Like windsucking or different stereotypes is linked to oxidative stress. Or repetitive disease or infections, but like in any animal. And of course, the aging, right? The more the horse age, the less glutathione has in the cells, and the more susceptible to have oxidative stress. Poor nutrition, it needs to be watched out, all the nutritions, but a diet that has no antioxidant. Or let's say many of the horses that I see, they are unbalancers, but if we don't have a good glutathione levels, it's not going to work the same, right? So on top of the nutrition, on top of the balances, we need to raise the glutathione levels. And of course, environment factors of the horse, in which environment this horse is living is going to be lead to oxidative stress. And I want to share with you Trilby. He's a 24-year-old thoroughbred, wonderful. He's a wonderful, wonderful character, wonderful horse. He suffered from osteoarthritis. He always been difficult to keep a good weight. Lately, last year, he had leukonia, but he was treated with very successful antibiotic and Chinese herbal medicine. He had some episode of recurrent laminitis, and he was treated every other month with acupuncture Chinese herbal medicine. But then we say, okay, why don't we add the Immunical platinum, yeah, 1 sachet per day, this precursor of glutathione. 3 weeks after, because, when we add this, he was recurrent with the feet. It's like it took longer to recover. So why this happened? Why those animals that normally they're fine very quickly, it takes longer to recover? Because chronic inflammation, because the age, because the level of glutathione low. So we add this 1 sachet per day, and 3 weeks later, owner was so happy, say, okay, the feet recovered very well. He was maintained. Look at him. Nobody will say he's 24 years old. Optimal weight. He is in his best version. So he was actually, and he keep on doing fantastic. So the dosage, many of you may be thinking, but how much I give to my animal? That's okay. It's going to be different experience, different authors, different veterinary colleagues, they will reflect. So for me, it makes sense. It's about principle of individuality, right? And also how oxidative stress, how is the level of the oxidative stress of this animal? And also, is this animal is not only on this product, but also other therapies, as I say, acupuncture, Chinese herbal medicine. It's a summatory. We don't need to get out of the formulas. We need to add something extra. So the range are variable, but in my experience, it goes from 0.1 by kilo body weight to 2 grams by kilo body weight, with 0.1 like a prevention, because we want our animals keeping the good glutathione levels, or 2 grams by kilo body weight in another patient's older or with another associated pathologies. This is in small animal. But about equine, it can go from 1 sachet, 10 grams per day, to 60 grams a day. And every animal, I promise you, every animal responds differently. So we, as a vet, we need to find a tailored dosage, okay, for every animal. Other authors, okay, this is in Spanish. You will see from 10 kilos, 1/4 of blue or 1/4, but that in case you are interested in knowing more, I will be more than happy to share with you different dosage and, of course, more information about these products. So, in conclusion, the chronic process lead to a high level of oxidative stress, and this is linked directly with a deficiency of glutathione. So we will need to supplement with glutathione for animal health. And we need to remember the synthesis of glutathione is difficult, so we need to give the precursors of glutathione, because if we eat glutathione, it's not going to exceed the gastric transit. Yeah, the absorption of the intestinal will be nil. So we need to really give the precursors. That's the key. We learned before, we don't have transporters from exterior to interior, right? So we need use a source of amino acid limiting resources. We need a cysteine bioactive and consolidated form. This is the only product in the market from 25 years of research when they found cysteine bonded, and that's how we can incorporate glutathione intracellular. Okay, this is a book that I recommend you about oxidative stress, cancer, ADAs, and neurodegenerative disease, written by Luc Montagnier. And the chapter 42 is related only about these precursors, right? Only about this immunocal. So this is very, very, very important. These are the products. And you will just go very briefly about this. In case you are interested to know more, I'm more than happy to help you to know how can you raise your glutathione levels and how can you help your animals to raise their glutathione levels. This brand, ImmuneTech, they have 78 medical patents, and they are created in Canada. But I will go, and they have over public studies and over 23 double-blind studies that support how immunocal raise glutathione levels. So this project is for you and also for your patient. It's a great health project. Why? One of the things that I realized as well was like, okay, if my dog has resolved, then I'm going to take it for me, because we are vets and we handle a lot. We handle with the chronic, we're vets or therapeutes or just caregivers, right? We care about our animals. So chronic stress, chronic fatigue, compassion fatigue, that's every single day. Sometimes we feel isolated, like this beautiful stone, but emotional issues, we take them home. Also financial problems sometimes. So burnout syndrome is very, very common in our profession, unfortunately. So Immunical give you the possibility to improve forever your health and your quality of life in all the aspects, physically. Why? Because once you start to take it, you will rest better, you will have more energy, and you will have a better sustained performance. Also emotionally, because once you rate your glutathione levels in your blood, you will increase your serotonin precursors, yeah, because the brain is 50% made of glutathione as well. But also financially, you will be able to go as far as you want, right? Because immunotech also can give you a business model if you are interested in that, with unlimited passive residual income. So I will not go further on this. I just leave it here. These are my book reference, but also all the reference on the PubMed, as I say at the beginning of the lecture, that you can go and check glutathione on horses, glutathione in cats, glutathione, and you will see all I've been saying today. And if you want to know more, now is the time to either email me or just WhatsApp me, right? Okay, you can just WhatsApp me here. So, yay. I think I am finished with the lecture and I'm gonna stop the sharing for now. Okay. And I don't know if we have any question. Hello, hello.
Hello.
Let's see, no chat questions?
No, there's none on the chat
Probably
box.
everybody's sleepy. No, I'm joking. I hope no. What I'm gonna do, then if it's no question, I'm gonna stop the recording now.